A new study published in Neurology has brought fresh attention to the connection between obstructive sleep apnea and brain health, particularly in aging populations. The findings are striking, pointing to a strong association between low oxygen levels during REM sleep and subtle changes in brain structures linked to memory. While this might sound alarming on the surface, there's another way to look at it. This research is a valuable step toward early intervention, improved diagnostics, and potentially transformative treatments for cognitive decline. By identifying sleep apnea not only as a respiratory issue, but also as a neurological concern, scientists are expanding the landscape of preventative care in aging and neurodegenerative disease. Obstructive sleep apnea, which causes repeated interruptions in breathing during sleep, is already known for its effect on energy levels, mood, and cardiovascular health. But this new study shows that its impact may reach further into the brain than previously understood. By tracking 37 older adults, the researchers were able to use brain imaging and sleep studies to demonstrate a clear relationship between lower blood oxygen saturation during REM sleep and the presence of white matter hyperintensities, small bright spots on brain scans often considered markers of tiny vessel damage. Importantly, they also found that these changes were associated with smaller volumes in the hippocampus and entorhinal cortex, two brain regions that are central to memory processing. These structural changes, in turn, were linked with modest declines in performance on memory tasks, particularly those dependent on quality sleep. What makes these findings encouraging is that they offer a tangible pathway toward prevention. For decades, one of the major challenges in combating Alzheimer's disease and other forms of cognitive decline has been the difficulty in identifying modifiable risk factors early enough to make a difference. This study suggests that sleep quality, and more specifically, oxygen levels during REM sleep, might be one such factor. That presents a powerful opportunity. Unlike genetic risk factors or irreversible age-related changes, obstructive sleep apnea is treatable. Devices like CPAP, continuous positive airway pressure, machines, positional therapy, lifestyle changes, and even certain surgical options can drastically improve breathing during sleep. If these treatments not only improve daytime energy, but also protect brain health, they take on a far greater significance. Moreover, the study shines a light on how deeply integrated the body's systems are. It emphasizes that the brain does not exist in isolation, and that what happens during sleep, often overlooked in clinical practice, has profound consequences for memory and cognition. The findings may also help explain some of the variability in how people age cognitively. Two individuals of the same age and background can experience vastly different trajectories in memory function. Sleep patterns, and particularly undiagnosed sleep apnea, could be one of the hidden factors influencing that path. By uncovering this connection, scientists are giving both patients and clinicians another tool in the toolkit to maintain brain health over time. It's also worth noting that the study included participants without obvious cognitive impairment. This is significant because it highlights the potential for early detection, finding biological changes in the brain before symptoms manifest. That kind of foresight is exactly what's needed to delay or prevent more serious cognitive illnesses. If we can begin identifying at-risk individuals in their 60s or 70s based on sleep characteristics, we could potentially intervene a decade before memory loss becomes apparent. Sleep studies, which are already safe and accessible, could become a cornerstone of preventive neurology, especially in populations at risk for Alzheimer's disease. Even the study's limitations, such as its small sample size and relatively homogeneous group, point the way toward more comprehensive research. Future studies will almost certainly expand on these findings, using larger and more diverse populations to confirm and refine the link between oxygen levels during sleep and memory-related brain structures. This foundational research opens the door to long-term, large-scale studies that may revolutionize how we think about aging and brain health. It may also lead to innovative therapies that go beyond CPAP, targeting the vascular and neurological changes directly with tailored interventions. In the end, the significance of this study is not that it uncovered a dire threat, but that it offers a chance for early correction and protection. For millions of people living with undiagnosed sleep apnea, this is a call to action, to seek assessment, to engage in treatment, and to think of sleep not as a passive state, but as an active contributor to lifelong brain vitality. The link between sleep quality and memory performance is no longer theoretical. It is measurable, visible, and potentially modifiable. That is reason for hope. In an age where many fear the loss of memory as an inevitable consequence of getting older, this research points toward a more empowered future, one where good sleep could be the key to preserving what matters most.